Lung cancer is the most commonly diagnosed cancer in Canada, and it is the #1 cause of cancer deaths among Canadian men and women. In Canada, the 5-year survival rate among all types and stages of lung cancer is low at just 22%.
Bronchoalvéolaire lavage, or BAL, is a really old tool to detect infectious disease processes in the lung. We're trying to use BAL as a diagnostic tool for lower stage lung cancer, so 3 centimeters and lower, to better detect their mutational signature, that is what is driving them to be malignant. We use salt water to wash the bronchial tree and the alveolar spaces, recovers that water, and use that water to detect tumor cells. And if we detect tumor cells, compare the genomic signatures in the tumor cells with what was seen in the biopsy. So you're trying to use a technique that is invasive, of course, but it's less invasive than the other ones. Patients that maybe are scared of having a biopsy, their reticence to participate will be much less.
Historically, we have been dependent on tissue biopsies, an invasive biopsy, to make a diagnosis of lung cancer. With these new novel therapies, for instance, a blood draw or analyzing fluid from a bronchoalveolar lavage, we are going to be able to access potentially diagnostic procedures that are more readily accessible to all Canadians, addressing the equity of access.
If this project is successful, it will have major implications for patients, as you will be able to do a much less invasive technique to detect the lung cancer.
We may be able to diagnose more patients at an earlier stage of lung cancer, thereby improving patient outcomes by providing curative intent treatments for more patients, and also reducing the burden on the healthcare system.
I devoted my research to BAL because it's a diagnostic tool that can be improved. And if you improve the tools that you know are already working, I think that's progress.